Namaste everyone, myself Dr. Gayatri Patil and welcome to my channel Health Innova where health comes first. So today I am going to discuss about the low hemoglobin count or the iron deficiency anemia in children. What are the causes, what are the signs and symptoms, how it is diagnosed and what is the treatment about it. So if you find find this video really helpful, then hit a like button and encourage us. So let's get started. So now the question is that why the children gets iron deficiency especially in their growing age. So as we all know that the babies are born with a stored iron in their body and which gets utilized for first 4 to 5 months of their life, and after that when they get introduced with the solids apart from the breast milk, there are many children who get the iron deficiency anemia. So why and what are the causes of it? So the cause number one, if the baby is getting the iron deficient diet, means the parent must be careful that what nutrient or the what diet they are offering their children, whether that diet is full of the nutrients, essential nutrients like protein, iron, calcium, vitamin D, because these nutrients are very important for their growing age and for hitting their all milestones. So of course the 6-month-old baby and 6-year-old child requires the different amount of iron on a daily basis. So the parent must know the daily requirement of iron at a different stage of their baby's life. So suppose the baby is 7 to 12 months of age, they need 11 milligram per day of iron. Then if 1 to 3-year-old baby need 7 milligram per day, then 4 to 8-year-old need 10 milligram per day, then 9 to 13-year-old need again 8 milligram per day, and the 14 to 18-year-old, especially girls, need the highest amount of iron, that is 15 milligram per day, because they loses the iron every month from their menses. So and then 14 to 18 year of boys need 11 milligram per day of iron. So this is all a recommended amount of the iron on a daily basis. So the parent must know this and include the proper quantity of iron in their baby's diet. Then the next cause is if there is too much of calcium or if there is a excess of uh, milk in the diet. So when in an initial year before age 1, when we introduce, when there is a transitioning time that babies get transitioning from milk to the solids, there are lot many children, they eat solids but simultaneously they are much more dependent on the milk also. So there is a too much of the milk in their body, means there is a too much of the calcium in their body, and hence this increased calcium level will decreases the absorption of iron from their intestine. So you must know that what is the age appropriate calcium intake in a children, and accordingly you should offer the calcium or milk products to your babies. So the simple thing to remember, uh, if you increase the calcium intake or the milk and milk products, there will be the decreased in iron absorption in your baby's body. Then the next cause is that if your baby doesn't eat well or doesn't eat properly, this is a phase when the child is teething or when the child is unwell or they are hitting some developmental milestones. Definitely there are some internal body changes where their appetite gets lower down or there is no desire to eat. So that is the time the children does not want to eat the nutritious things, and then that results in a iron deficiency anemias. So make sure that you will make or cook some nutritious food with some delicious taste, so that your baby will definitely eat it and they get all the nutrients from it. Then the next cause is that if there is an improper absorption of vitamin C, then so this is something to be noted here, that vitamin C is also very much essential in the absorption of iron. Yes, if you're offering your child iron rich diet but there is a deficiency of vitamin C, then that introducing iron to your child will not absorb from your intestine, because for absorption of iron it must need the good amount of vitamin C in your body. So vitamin C again will help to absorb the iron which is coming from the diet. So the vitamin C must be included in your baby's diet. Then the next cause is if your child is having some health issues like chronic infections or some helminthic diseases or chronic diarrhea or any blood related disorders or some genetic blood disorders, then your babies can have the iron deficiency anemia. Then the next cause is if your baby is a premature, that is the baby is born before 36 weeks of pregnancy, or there is a low birth weight babies, that is a weight less than 2.5 kgs at birth. So this will again hamper the there is a lower stored iron in their body, so that and these babies really need the extra iron for their growth, and for that extra iron to be fulfilled they again result in the iron deficiencies. Then the next cause is when the babies or the children get exposed to the lead. uh, that means when you observe your babies when they are iron deficient, and many children will show this, that there is a craving of some non-material food which have no nutritive value. For example, ice or soil, chalk, pencils, or they just want to scrap the wall paints and just lick it. So this is called a pica, that is craving for the non-material food which has no nutritive value. So it will again there is a exposure to the lead from this all this non-material food or not non-material substances, and the lead will again interfere in the iron absorption, and your baby will suffer from iron deficiency anemia. So this is all about the causes. So now what are the signs and symptoms? So I will whatever this now I'm going to tell you whatever the signs and symptom. These signs and symptoms you will see in a different phases of your child's life, like during teething, or when your child is unwell, or when they are hitting some milestone, or simply just your child if your child is hyperactive. So you will see one or more signs from this. So I strongly advise everyone that before concluding that your baby is having a iron deficiency anemia, please consult your pediatrician and discuss about the signs which I am going to tell, whether they are that your child is showing. So discuss all about this with your pediatrician also. So this sign number one, that your child looks pale. Then the second is they feel lethargic, or they get too tired early on while playing. Then third sign is that there is a behavioral changes in your child, you can see, like there are concentration issues. There is something to known as ADD, that is attention deficiency disorder. There are many children will show this sign. Then there is a poor concentration, there is a poor school performances, there is a excessive irritability, and sometimes a child just hold their breath and cry a lot. That is called a breath holding spells. So then the next sign you can see is there is a craving for this all this non-material, non-nutritious substances, that is called a pica. Then the next sign is your child's hands and feet always feel cold. Then the next sign is that there is a poor appetite, or your child just simply does not desire to eat. Then the next sign is there is a frequent infection, or as there is a low hemoglobin, that is a low deficiency of the iron, it will again going to hamper on their immunity, and their immunity obviously gets lower down, and they will suffer from the different kinds of infections which they get exposed. Then the next is that you can see there is a slow uh, developmental milestones, both physical and mental. So these are all about the signs you can see in your child. Then the next is how you can diagnose this. So just meet your pediatrician, discuss about the signs. If your child is really showing the signs, then your pediatrician, your doctor will run a simple test called hemogram, and there are all the blood parameters in it, and if there is some deficiency they will sort out the levels of that deficiency, and accordingly they will give you the treatment. So basically, now the what is the treatment part. So I basically will recommend all the parents to fulfill their children's iron deficiency from the food or the diet, because it is the best way to give your child a good amount of iron rather than giving some supplements. If really they are needed, then your pediatrician will definitely recommended it, but focus on much on a diet. So remember here, the two things are the remember to be remember, that first one is the human body can absorb the iron best from the animal sources. So yes, so when you're offering your child the chicken, the fishes, eggs or liver, the red meat, lamb, turkey, uh, everything from the animal sources, their body work less to absorb the iron from this animal sources, and these animal sources are rich in a iron content. So must include this in your baby's diet. Then the next is from a vegetarian option. Remember that the red, brown and the green colored vegetables or the foods uh, are the richest source of iron from a vegetarian group. So in that, in a red colored food, there is a tomato, pomegranate, apple, strawberry or beetroot. And the brown option you can have potatoes, then the sweet potatoes, then a beetroot, or just a jaggery, good for their digestion. Then the green option you can offer them all the green leafy vegetables, then peas, broccolis, or everything which has a green colored, so you can offer that. Then good amount of vitamin C in their diet. So all the sour foods are the richest source of vitamin C. So in that, strawberry, tomato, lemons are the richest source. Watermelon, then papaya, um, then oranges, mosumi. These are all richest source of vitamin C, and of course generally the kids will love to have it. So the next is that do not overdo milk, or they reduce the intake of calcium in your kids. So remember that if your child is in between 1 to 5 years of age, do not give more than 700 ml of milk per day to your child, so that their calcium level will be in a in a balanced uh, balance, and of course their iron absorption will also not get hampered. So this is all about the things I have discussed. I hope this all will going to help you, and I will definitely be sure that all the parents will do the good job at their phase at this phase. So if you really find this video helpful, then hit a like button and encourage us. Comment down below if you have any question, and if you haven't subscribed yet, then subscribe my channel Healthy Nova, and press a bell icon so that you will get a notification whenever I upload a newer video. So thank you so much.